Hey everyone, welcome back to the channel. My name is Aryan Malik. I'm currently a nursing student. This is Study with Me series. Today is day 20. We'll be continuing our discussion on fundamentals, and today's topic is delegation and supervision. So let's get into it. First, we'll talk about five rights of delegation. The first is right task. You, as a registered nurse, should only delegate tasks allowed by state laws and workplace policies. For example, do not delegate IV insertion to nursing aides or unlicensed assistive personnel, also called UAP, as it is outside of their scope of practice. The second right is right circumstance. You, as a registered nurse, should know your client's status. Do not delegate a task for an unstable client. Now, for unstable client, it is really important to know whether there are new admission in an emergency department, someone complaining of chest pain. So you should be the one doing the primary assessment. You should not delegate it. There is sudden change in their status, especially if there is a sudden change in their mental status. You should be the one going and assessing and not delegating it. And if it's clients first time doing anything, maybe ambulating or walking, as there is a risk of falls, it is our responsibility as registered nurse to make sure they are safe, and we should not delegate this to either UAPs or LVN or LPNs. Also, who are returning to the floor after a procedure or a surgery, they require primary assessment by the registered nurse and can't be delegated. If a primary assessment is needed, the RN should not delegate the task. The third right is right person. Ensure the assistant who you are delegating to has the right skill level, knowledge, and experience. You, as a registered nurse, need to know that the person you are delegating the task to can complete it safely without causing the client any harm. Always, always assess the assistant's knowledge and skill to perform the task safely before you delegate it to them. The fourth right is right direction slash communication. Communicate goals, time frame, and when to report back to the person you're delegating it to. Always provide clear goals with expected outcomes and a parameter to repeat immediately. For example, a very high blood pressure. Let's look at a question. When delegating vital signs to an unlicensed assistive personnel, which action should the nurse plan to take? Communicate the time for when the UAP should report results. So, for example, they are seeing abnormal vital signs, they should report it to you as a registered nurse. It is your responsibility to make sure you are supervising what they are doing and also taking charge where needed. The fifth is right supervision. The RN, LPN, or LVN is accountable for evaluating the outcome of the task. You should always follow up and reassess tasks that you have delegated to an assistant. You, as a delegate nurse, are ultimately responsible for maintaining the task outcome. It is your responsibility. And also determining the task safety and the skill set of who you are delegating it to. An important key term that comes very often when we talk about patient safety is negligence. The RN, LPN, or LVN may be legally liable if you are negligent in supervising the UAP or nursing aide, also called CNA. You must you must follow up and assess what you are delegating. So you are going to get Otherwise, you're going to get in legal trouble if you delegate and you forget about it. So it is really important to assess and follow up. So those are the two main functions you need to remember when you are delegating. If the RN or LPN did not give proper instructions, you could be legally liable, and there can be repercussions. Now let's look at another question. An RN delegates a routine task to UAP, unlicensed assistive personnel. What are the legal consequences for the nurse if there is negligence by UAP? The RN again may be liable if it's found that they were negligent in supervising the UAP. So you always follow up and you reassess as a registered nurse. There's an acronym that Simple Nursing suggests for better understanding the delegation. Never delegate what you can eat. So, U here stands for unstable clients who are new, sudden, or even there is a change in their status as we talked about. So, let's talk about new admission. RNs must assess new clients first before delegating. Not all, but one should be mindful of unstable clients. So, if there is a client who walked in with chest pain, you as a registered nurse should assess them rather than delegating it to an LVN or an LPN. If a client is returning to the floor after procedure, you must assess first before delegating. You need to make sure you're checking all the boxes once the client returns so that they're safe and sound, and they are experiencing, like, there is no new onset of say pain or anything. So you need to make sure that the patient is safe and sound, and you should always do the primary assessment when they return to the floor after a procedure. And also, post operative after surgery, you as registered nurse assess first uh, something which is called and something in terms of, like, again assessing if there is new onset of pain, and these are the assessments which you as registered nurses do and are fall under your responsibility. Then you also assess for unstable blood sugar, vitals, and lab values. So this can be assessed by the other assistants as well, but what they can't do is trending and interpreting. So they cannot kind of compare and interpret the data between what was the lab values or what were the blood sugar or what was the vitals between now and say 5 hours before. That is responsibility of you as a registered nurse, and that falls under your wings. And say there's a sudden change, a respiratory rate, a neurostatus, you must be vigilant on unstable clients. So you need to have an eye out for them, and you need to be supervising that, and basically it falls under your responsibilities. Now, E is for evaluation, again trending or interpreting data like lab values, pain, vital signs. The thing to remember is LVN or LVNs, they can take vital signs, but they cannot evaluate or trend. They cannot compare, interpret, or even evaluate what the client is going through. That again is you as a registered nurse, your responsibility. A for assessments. Initial first primary assessments are done by registered nurses. Unstable clients or who are new here. So new admission post operative again falls under the nurse responsibilities and it cannot be delegated. So we have covered the acronym never delegate what you can eat. So for you, we talked about unstable clients. E, we talked about evaluation. A, assessment. And now we go to T, which is teaching. Initial, first, and primary education is the responsibility of registered nurse, LVNs and LPNs, they can reinforce the education, but they can never give first or initial education. So, for example, they can give reminder when the use of incentives parameter after surgery and why is it needed. So that's part of a secondary education, but they cannot be the ones who are taking the medical device to the client and telling what it is, how is it used. That falls under primary education, and that is the responsibility of a registered nurse. Another very important thing to remember is there should be no delegation of IV push medications. LPN and LVNs can hang IV piggyback medications. That also can vary state to state, but they cannot give IV push medications. While CNAs and UAP, they are a big no for medications. They cannot administer medications that's beyond the scope of their practice. A side note here is some LPNs, they can take a certification course to start IVs and give some pain IV medications, but that also varies from state to state. One other thing to remember is no blood transfusion, blood products like RBCs, platelets, plasma, and no central line drugs like chemo, TPN can be administered by LVN, LVNs, or any other assistants. That again is the responsibility of registered nurse. Now, let's take a step back and look at what are some of the responsibilities of CNA and the UAP. This might not be tested or might not be important for a registered nurse, but again, it gives us a little background on what we as registered nurses can delegate. So, simple nursing again suggests a acronym for it, which is vapor. So V denotes vitals, so they can take vitals. A for ambulation, ambulating, basically a client who is stable, not at risk for falls. P for position changes, bathing, and E for eating. But here's also an exception. They cannot we cannot delegate them to a client who has, say, NPO or swallow precautions. Anyone else, they can help with feeding. And R is recording intake and output. They do not indulge in any teaching, nor they do any assessment, and they cannot administer any medications. Now let's look at some questions. A client is newly admitted for a myocardial infection, basically a heart attack. Appropriate activities to assign to unlicensed assistive personnel UAP would include all of the following except teaching about what foods are high in Na. Now they cannot do it because it's the teaching does not fall under their kind of umbrella, so we cannot delegate teaching to them. Recording intake and output, yes, they can do that. Assisting with ambulation to the I am stuck with this word. Assisting with ambulating to the restroom. Yes, definitely they can do that, but again, they should be careful while ambulating, as the person has just suffered a heart attack, so they have to be careful with that. Reporting to the nurse that the patient complained of chest pain. Yes, they can do that. Absolutely, they can do that. Now let's look at another question. Which of the following should the RN delegate to the LPN or LVN? Select all that apply. Administering sub-Q insulin. Yes, they can administer medications through all the routes except IV push. Assessment of client returning after a ERCP procedure. Now the keyword here is returning. So after a client has returned to the floor from a procedure, initial assessment is conducted by a registered nurse. Initiating a primary IV medication. Again, initiating, which means it's new. They can do piggybacks, but initiating a primary IV medication falls under the responsibility of registered nurse, and registered nurse must be there to assess any type of new medication. Reinforce teaching for a client recovering from surgery. So reinforcing, which is secondary education, which means primary has already been done by an RN, so yes, they can go forward with that. Urinary catheterization, yes, they can do that. Secondary assessment of a client's chest pain. So again, key term here is secondary, so no first or initial. They can move forward with that. With that, this marks the end of the delegation and supervision video. I hope you found this helpful. Please stay tuned for more videos that are coming out in the future. Thank you for watching.